Hi, everybody. This is Abnormal Psychology in the introductory material, video number 3. And we're going to start off with a little bit of overlap. But I want you to check this with your PowerPoint open. And you will figure out quickly that this is material that is really core to the course. Very important material, okay? So this is the slide number 19 on calibrating mental disorders. Okay, so calibrating mental disorders, and what you'll see is an arrow that represents a continuum from no clinical disorder, mental disorder, to severe. So all disorders have mild, moderate, severe, but then we have this region called subclinical, which is where people who have some symptoms but not enough, either in number, amount, or intensity, or duration. There's a piece missing that allows you to otherwise make a diagnosis of a disorder. So, for example, you may be very sad that something has happened, but it doesn't rise to the level of depression because in major depressive disorder, at least, you have to have 5 of 9 symptoms for a minimum of 2 weeks. We'll get to that later in the course. So you would say maybe that this person has some subclinical symptoms of depression, namely sadness most days throughout the day. Maybe they have 1 or 2 other things, but they don't have 5 of 9 symptoms, okay? All right. So you remember the normal distribution curve that we looked at in the previous slide that told you about this subclinical group. There's a group that's languishing a bit. You know, they're not doing as well as they could. This is often the subclinical group. Okay, so keep that in mind. We would want to designate what makes a disorder mild, moderate, or severe. And the way we do that is to look at the impact it has, the distress that it has on the person with the disorder. Okay? Now, let's ask a few questions here again about what is and what is not normal. Is it normal that when you can't sleep or eat or study for days, if somebody unexpectedly breaks up with you, that you didn't know this was going to happen? Is that normal? Yeah, normal. Avoiding the elevator because you fear it may get stuck. It's not a trick question. It's not in the area of abnormality, particularly if the elevator has been known to get stuck on occasion. But if it hasn't, and it's a 1 floor elevator, then to react to getting on the elevator with extreme anxiety, that would be abnormal. But to simply go, yeah, I'd rather walk, that's not unusual, really. Refusing to eat except for vegetables in order to stay thin, that's abnormal. That's abnormal eating pattern. It may or may not rise to the level of an eating disorder, but it is disordered eating if you follow the difference. Now, some people eat very little and may restrict what they eat for particular reasons, not just to stay or get thin, but they have a photo shoot coming up, or a prom, or clothes they want to fit into because they don't have enough money. There are many reasons why, but for someone to descend over time into eating less and less and less high calorie foods, where you're eventually eating a mono diet of, say, Diet Coke and lettuce or something, that's extremely disordered. And then at some point it would reach the level of an eating disorder, such as anorexia nervosa or some other. Always having a few beers before going out to meet friends. Yeah, that's unusual, and it is not necessarily at that moment going to mean that they are have a substance abuse problem. That is to say, a named disorder, substance abuse disorder, but it's certainly suspicious in terms of their need to do that. And then that would be the time early on to have an intervention for them to engage some help to sit them down. Um, Not being able to get an erection as a male, well, it depends on your age. If you're over 50, you have a much better chance of having that experience and may develop a sexual disorder. But every male at every age, on occasion, cannot get an erection at all or an insufficient erection for sexual activity. For females not ever having an orgasm, well, somewhere around 10%, we don't know the exact number, 10, maybe even 15% have never had an orgasm. There are lots of reasons for this. Female genital mutilation, a requirement based on the way in which the female's body is wired through their nervous system, the requirement for very, very, very high intensity and sustained stimulation, which they've never had. Lots of reasons. Guilt that's induced by certain families or religions could also impact this. I've worked with a number of clients in this situation. So, lots of reasons. All right. Then I want you to think about these things. The dividing line between normal and abnormal is very thin, yes, and it's not easy to define. You have some abnormal behaviors on occasion, even though you don't rise to the level of having a disorder. So in other words, not the same number that's required or in the amount or for the duration. And then, so these things are not that we're going to study that are disorders, not anything that we don't know anything about, we know nothing about. We know something about all of these, particularly the first set coming up later, which are the anxiety disorders. So what are the common elements of abnormality? Well, one is typically distress and suffering. If a person's not having any distress or suffering, could they still have a disorder? An impairment or dysfunction? Risk to oneself or others, either suicidal risk or self-injury risk or homicidal thoughts. Deviance from social standards or cultural inconsistency, not consistent with the culture's notion of what is and what is not abnormal. Statistical rarity, not common. And observer discomfort, would someone be uncomfortable if they saw what you were doing behaviorally? Well, there are some exceptions, and I want to tell you about those. So, according to most clinical guidelines, behavior has to be personally distressing before it can be labeled abnormal, but there are cases, particularly in the area of personality disorders, where not everybody's distressed. Also, some people have extremely low or absent insight. So they're not actually distressed or not aware of things enough to say that they're distressed, you see. So, for example, in a manic state, in bipolar disorder, they're not going to tell you they're distressed. They feel everything but that. Of course, over time, they will be able to describe distress and impairment. But in the case of, say, antisocial personality disorder, they typically don't feel much distress unless they're being arrested or have to evade capture if they've committed a crime. Is there impairment? Well, abnormal behavior tends to be dysfunctional. It interferes with your daily activities of daily living. Yeah. So, also culture has an influence on determining the perception of dysfunction. Yes. And dysfunction alone does not necessarily indicate psychological abnormality. Yeah? So let's take the case of transvestic disorder. Typically males dressing as females, and they can go full 9 yards. Shoes and stockings and underwear and so forth and so on, outerwear. Makeup and so forth. And now there are even websites, you can just Google it and find them, that cater to these individuals. Now, except for the fact that they enjoy dressing up as females and may socialize in places that accept that with others often, except for that, there may be no dysfunction. Now, there is the potential for impairment and dysfunction if their partners don't approve. Okay. Is there risk, personal or other injury? Well, it's a myth that former patients, once treated, are dangerous. That's a myth. But left untreated, there are a few that are dangerous. More that are dangerous to the person who has an untreated condition, such as major depressive disorder, bipolar disorder, and even eating disorders. There's dangerousness associated with that. You may know this, that prisons are disproportionately populated with people who are mentally ill. And so this issue of risk is a complicated one. It has mostly to do with whether the person has been treated or not, and whether they've received the adequate treatment and a long enough of adequate treatment. So are mental disorders statistically rare? Well, about 1 in 100, 1 in 90 to 95 in the world have schizophrenia. 1 in 10 to 1 in 20 have depression, major depressive disorder, or some other kind of depression. 2 in 3 out of 100 have bipolar disorder of one kind or another. There's several. About 1 in 6 to 1 in 10 have an anxiety disorder. And about 1 in 11 to 1 in, maybe even 1 in 8 have a personality disorder. And about 1 in 24 have ADHD. Overall, if you include all disorders, including specific phobia, somewhere between 26 and 45% of the general population, at least in the United States, has some disorder. Okay? All right. Here's what doctors ought to know, and I'm going to cover this very briefly. 70% of all medical health visits have a substantially psychosocial basis or impact. The 10 most common complaints that are seen in a primary care setting have no observable or demonstrable organic basis. Yep. Most people get help for things like drug use, anxiety problems, and other mental health issues from their primary care physician. Most everybody does. The vast majority do. They don't want to go to a psychiatrist who is the specialist in using medication and some other things for treating such things, particularly diagnosing properly. Medical doctors who are generalists do not get the same level of training in any way as a psychiatrist. So if you look at any disorder, somewhere around 42% of people have something. Oklahoma is in the high range of between 19 and 22% of the population with some mental disorder. Other states include Maine, the Pacific Northwest, Utah, and everybody's favorite, Mississippi. West Virginia, Indiana are the states that have the highest level of, in terms of the population percentage with a mental disorder. Females are more likely to have anxiety disorders, more likely to have unipolar depression or major depressive disorder. In terms of substance abuse, males are twice as likely. Those are interesting ideas to keep in mind. We know that another category of most disorders is that they are deviants from cultural standards, and some are culturally bound. More on that in the next video.